Welcome to the Mental Edit, where we keep it real, unfiltered, and honest, because mental health is complicated. I'm Meghan.
And I'm Rachel. We're here to have candid conversations about mental health, what it is, what it isn't, and everything in between.
The Mental Edit is for educational and informational purposes only. We are mental health professionals, but this podcast is not therapy, medical advice, or a substitute for professional treatment. If you're struggling, we encourage you to reach out to a licensed mental health provider. And if you're in crisis, please seek immediate help from a trusted professional or emergency services. Now, let's get into it.
Welcome back to the Mental Edit. This is episode 5. We're going to be focusing on panic attacks. If you've ever had a panic attack or what you would consider an anxiety attack, you know how terrifying they are. They really come out of nowhere. They often send people to the hospital. They're really scary. It kind of feels like your body's turning on you.
Absolutely.
It's the best way I could describe it. So yeah, we're going to get into what panic attacks are, how to know the difference between panic and anxiety attacks, and then more importantly, how you can treat them and how we treat them.
Absolutely. So I'm going to start out with just giving us some basic information about panic attacks and what they are. So a panic attack usually is a sign between our body and brain that something is not right. We feel like we are choking. We cannot catch our breath. I am not okay. I am sweating. My muscles are tight. You need to call the ambulance. It is intense. It is quick. Panic attacks are under 2 minutes. Fun fact, over 70% of humans have had a panic attack in their life. So
That's
they're quite,
a big stat.
Yeah, they're quite common.
Yeah.
But that's what makes the difference between a panic attack and panic disorder. So during these panic attacks, we feel like our life is at risk, which is usually how we end up in the hospital. And
because your heart is racing, you kind of feel that sense of dread. You actually do have thoughts often, right? Like, am I dying?
Yes.
Which is very scary.
And usually when having a panic attack, there's not a correlated stressor. It comes out of nowhere. And that's what makes it different than an anxiety attack. An anxiety attack is in response to a trigger or a stressful event ahead of us, maybe related to an upcoming wedding or a graduation. And we have this intense anxiety and worry that comes on, and that can last hours or even days, an anxiety attack. One is not better or worse than the other, but a panic attack is definitely more acute.
Yeah. And I would say probably physically more intense than an anxiety attack. Okay.
Yes. We feel like we are having a heart attack. We are going to throw up. There could be vomiting involved. It's more of a physical manifestation panic than anxiety. And it's usually that heart attack workup that we have in the hospital where the heart attack is rolled out and we are diagnosed with panic, which leads to this diagnosis of someone in the ER saying, oh, it's just a panic attack.
Yes.
And then we have this shame and guilt that, why did I even come here?
Yes. I hear that
silly.
A lot. Like, this was so stupid. I went all the way to the hospital for that. And I always try to reframe. No, it's good. You don't want to have something wrong with you, right? Like, you don't want to have a heart condition or something wrong that requires workup and follow up, and then sometimes, they do kind of send you on your way.
Which is scary because that is the difference between panic attacks and panic disorder.
Yeah.
So when we start to have this obsessive fear over it happening again, that is when we develop the disorder. Our world starts to get smaller and smaller. We don't want to go to our church gatherings anymore. We don't want to go to the shopping malls. What if I do this in public because of the shame or guilt? What if I'm on an airplane and this happens and I can't escape or get to the hospital? So our world is starting to collapse in.
It's almost the panic disorder kind of then creates the phobias and anxiety disorder associated with it, right?
Yes.
Because you start to be hypervigilant for situations that might make you feel that same way again.
Yes. So although 70% of people have had a panic attack in their life, only 3% of those people develop panic disorder. What I will say as a prescriber, getting in quick to see a prescriber is very important. And I believe in therapy for panic disorder or panic attacks as well. But this is where I lean more on the side of medicine. We need an anti-anxiety medication on board pretty quickly. So we can be proactive in stopping the disorder from setting in.
And the good thing about having that prescription with you is that it becomes your like emotional support blanket. Whereas like you could be in a situation and if you can't use your coping skills, you have that. And even just knowing that you have that tool that works can help then with the panic attack at the time.
Yes. So normally I do not like to prescribe an SSRI or SNRI for acute panic attacks, panic disorder, because they take 4 to 6, even 12 weeks to reach full therapeutic benefits. This is the time truly when a benzodiazepine such as Xanax or Ativan, other benzos include things like Valium, they're more appropriate because they work immediately and in
on
the
the
moment.
central nervous system
Yes.
to just calm you down, which, it does feel, panic attacks feel more central nervous system than an anxiety attack.
Those eardrums, we can hear them, our heartbeat, we can hear.
Actually, let's give a rundown of what are, why don't we run down the different symptoms of a panic attack?
Yes. Muscle tightness, sweating, fear of passing out, fear of dying. There's choking, nausea, vomiting, anything really physical. I am not okay.
Depersonalization, that kind of feeling like you're floating above yourself.
And derealization, where you feel like you're part of a movie.
Yeah. And those are very eerie feelings, especially if you're not used to feeling them.
The best example being millennials in New Jersey.
Yes.
It's The Sopranos.
Oh, that's a good one. Yes.
I love The Sopranos. One of my favorite shows. Dr. Melfi, she's my girl.
Yes.
If I could be anyone in life, it would be Dr. Melfi. Fun fact.
That is a fun fact. Wow.
Right down to the glasses. Maybe I should go shop for some glasses. But Tony Soprano had his first panic attack at the family barbecue.
Yeah.
He fell down. They took him to the hospital. Here's this big mafia kingpin guy, really head of New Jersey, rolling the roost, and he's having panic attacks, and it did turn into panic disorder. And that's the premise of the entire show.
Yeah, that's right.
Yeah. So anytime Tony was seeing the gabagool, he was then having the episode of panic, which then led to the panic disorder.
Yeah, that's something I notice a lot with my clients. They will have something attached to the panic attack, like gabagool, or like a certain flavor they ate that day, or a meal, or a breeze, or like a sensation, and then that can that can trigger that feeling of like, is this gonna? A lot of panic disorder, in my opinion, is like, is this gonna happen? Is this happening again? Is this happening right now? Is this happening right now? And your brain starts to panic, and you start to be hypervigilant, right? You look around, like, is anyone here gonna help me? Would someone help me? Then maybe you find like a friendly face in the crowd. You're like, okay, that person might help me.
Your ears start to ring. You feel like you're gonna pass out. Yeah. What you said though about heightened senses or something that resembles the first panic attack, it's very true. It could even be a scent, like the smell of spring, and you start doing lawn work again. You had your last panic attack last spring. You go out with your ladder, which was there last year when you had your panic attack, to do yard work this spring, and you go, my goodness, here it comes again. It's going to happen. Call up your wife, get me to the hospital right now. It could be something we see. It could be a certain temperature. I believe you said that. But anything sensory, even clothing. Let's say we had a panic attack on our wedding day. We might not have a fear of going to weddings now.
Yeah. And a lot of normal sensations you have every day, dehydration or, blood sugar could be low because you haven't eaten in a while. That also triggers those feelings. Dehydration is a big one I found because people don't always notice they haven't had any water that day. And then you get those sensations and then you just drink. And it's like, just drink a little bit of water and then it goes away and you're like, oh, but it's good to learn your body and know, what can calm you down in the moment.
Yes, because in medical terms, when you're dehydrated, we call that being dry. And in order to keep our vitals stable, our heart rate will compensate and shoot up to keep the blood pressure stable or vice versa.
Medical fun fact.
Yes. So when you're running dry, that heart rate goes up and it mimics the feeling of having a panic attack. Or let's say you're in a sauna and your blood pressure starts to go down and you get dizzy, your heart rate shoots up and then you feel like, again, you're having a panic attack. And now you feel like you can't go to saunas and you say no more to the spa or saunas because they give me panic attacks. And that's when we're giving into the power of panic disorder. So let's picture that someone was gardening and had a panic attack and they saw a snake and full on panic attack. So they start to not leave their house because they see a snake outside all the time. In reality, that's a garden hose. So our mind and body are in battle with each other and we stop doing things we enjoy when we give into the panic disorder. And that's why when a patient calls me and says, I'm having these feelings that I'm going to die. They don't know at the time. It's usually panic. I like to get them in as soon as possible, the first cancellation I have, because the longer we wait, the harder it is to pull them out of that hole.
So they develop what's called agoraphobia. So agoraphobia is really the fear of leaving your house.
Mimics OCD a little bit when our world gets smaller and smaller, which is why I want to talk about OCD in a future episode. But we're giving in to our mental health diagnosis then. And we want to really be strong and try to fight it. And the sad thing is, yes, it affects our lives, but it's going to affect people around us as well. Our coworkers want us at work. And
our family wants us to go out to restaurants, go on trips. leave the house.
I want to talk about shame and guilt in correlation with panic, because shame and guilt with panic are so strong. After a panic attack, we usually, and most likely we did seek medical attention in the emergency room. We feel like, oh, we weren't good enough to get that medical treatment. Nothing is truly wrong with us.
Yeah.
I'm not good enough. I feel guilty that I wasted someone's time or resources. And then also comes signs of depression, because depression is this hopelessness, worthlessness, guilt, and shame. And we're not feeling like we're enough. And we're also no longer engaging in the community. So what I see a lot of times also after untreated panic attacks is panic disorder and depression.
I think with panic attacks, it can be the first time for someone they don't feel in control of their body.
Yes.
And that is a very traumatic thing. You know, you want to be able to trust that you do the same things every day. Your body's going to respond the way you expect it to respond. So when a panic attack comes, it really feels like I've lost control. And that can be hard for people to move on from trusting their body again and trusting that they know and have the skills to push through.
The word here is betrayal. The relationship between your brain and body was betrayed.
Yeah.
It was not your fault, but this brings in that low self-worth and the depression. So luckily, if we do bring on an SSRI to kind of work in the background as we have those emergency medications, it can also help the mood and depression.
Yeah.
Usually when we treat panic disorder, it is not a lifelong journey on medication.
That's
I would say usually 6 months up to maybe 2 years.
You might carry it around forever though, right?
Yes. You're talking about the as-needed medication, the benzoyl Xanax or Ativan. Yes. And I want to
I mean, the amount of people that tell me they just have like a few that they keep in their purse is very cute. Yeah.
I had one patient actually yesterday, and they mentioned that they haven't touched theirs in years. And they go, is it okay if I ask for more? Because they're starting to disintegrate.
Yeah.
Yes. Let's get you a new prescription.
Yes.
How I suggest my patients carry around their as-needed medications. If you go into a drugstore, there are these little capsule keychains that go onto your keys.
Oh, okay.
And I say put 1 or 2 in there, because you don't want to put them in an unlabeled Tylenol bottle. You do want them in your purse. You don't want all of them kept at home, because that's not appropriate.
Yeah.
I don't want them just sitting in the bottom of your wallet disintegrating. So on your keychain, on your keys, there's a keychain at drugstores, or order it offline, where you can put 1 or 2 in. They're water safe. And if you were in ShopRite or a grocery store at a family function, you can take that as needed medication.
Yeah. I think ultimately that gives you confidence again with your body and learning how to, manage the symptoms as they come up, because there is a way to catch this before it goes into full blown panic. And maybe we should talk a little bit about how you treat panic disorder or panic attacks.
How I treat it in the moment. Because we can talk on that. I think that's important, where if you don't have your as needed medication, or you haven't been prescribed medication yet, and you're at a family function like a wedding, how can you de-escalate? So the best form of de-escalation is going to be full grounding. So what I would suggest if you were at a family wedding is to go outside, excuse yourself, actually take your shoes off and put your feet and your hands on the ground.
I like that you keep bringing up the wedding.
I don't know. To me, that's like one of the most stressful events of a life.
Yeah. Oh, you're talking about like the actual bride.
Anyone.
I guess it could be, people do get really hung up on like being like having to be in the center of attention or make a speech or be in photos.
Yes.
Yeah, that's true.
Let's use another example. A performance.
Yeah.
You're about to perform or be at a spoken word coffee shop and you're having a panic attack beforehand.
You know what? And maybe it really is just about any time you might have a little bit of a spotlight on you.
Yes.
Could be a birthday party, could be a friend's event, anytime you have to kind of show up, or even it could be going somewhere with your spouse, like their event and you are the plus one. And maybe it's just any time, that could trigger feelings of panic.
There are going to be eyes on you, and you know what is involved at this point in a panic attack, and what happens at this big social gathering. If you have this panic attack while all eyes are on you, people are going to judge or think certain ways of you, or that you're not in control of your body.
But the wildest thing is from the outside, you look totally fine.
Yes. So what I would suggest is going outside, taking off your shoes. If you're in, let's say, a Target and it happens, I use this example with my patients: crouch down on the ground, pretend like you're looking at something on the bottom shelf, and put your hands on that cool shelf. We want to engage multiple senses at once.
Okay.
I also encourage my patients with panic disorder to keep Altoids in their purse, or warheads. You can still buy warheads, and that strong taste is able to activate your nervous system to distract it, to
just kind of switching it in a
panic.
different direction.
Yes.
That's interesting.
Also,
like redirecting.
Yes, with essential oils. If you're having a panic attack, you can pull out a peppermint essential oil. They put them in these chapstick containers almost right now, and you can distract your senses with peppermint oil, and then also a rubber band on your wrist. You can use that. Also, if you're in the safety of your home and have access to ice and cold water, you can put your face in a basin of cold water and ice. But all of these are going to reset that nervous system and distract it.
And from a therapy level, we really use a lot of CBT or cognitive behavioral therapy. So that would be, you know, even just taking an inventory of all the different things that you think could trigger a panic attack, right? And then being prepared for that in the moment. So you feel that in input stimulus, you kind of can't stop the input from coming in. But I always talk about what is your reaction to it, right? Do you have to engage with that? Or can you say, okay, that is a panicky thought. I'm going to take a deep breath. I'm going to calm myself down and I am okay. You know, I tell clients, I'm like, get a mantra, whatever works for you, right? Like, I'm okay in this moment. I'm okay in this moment. I think that helps it's like you're just trying to stave off the reaction that your body could have, right?
Yes. So I think if we have a panic attack, having a skill such as CBT, cognitive behavioral therapy, catching, challenging, and changing, editing our thoughts is important. Also exposure therapy. Yeah. And that will help from those panic attacks becoming more frequently and leading to panic disorder. And for exposure therapy, we need a specific clinician who's trained and certified in exposure therapy to really move forward, because we use exposure therapy also in OCD.
I was going to say that,
with the agoraphobia. So with our worlds becoming smaller, we need that exposure for them to start growing again. So these types of therapy aren't as great in the moment. Maybe if you sense it coming, you could alter some of your thoughts and lean into CBT. But as it's happening, you are not going to have that skill set while you are in your 2 minutes of true blue panic and wanting to call an ambulance to say, let me name this distorted thought right now. Yeah.
I think the exposure therapy comes to when you said like the phobias develop. So you have the classic ones, flying, elevators, bridges. I feel like even talking about these for some people, it's like, oh, yep. Sometimes driving. I find with that panic disorder, driving becomes a big issue too, because you're like, I'm on the highway, you know, so all those are good for exposure
your
therapy.
Life at that moment. It's also other people's lives, because if you're driving and have a panic attack, yes, your life is at risk, but you realize if you were to, for example, have an accident with your car, you could affect someone else. Yeah. So panic attack is very real. It's interesting to me, the difference in the statistics though, from 70% to 3% actually having disorder. That gives me hope for my patients who come in with an attack, to give them that statistic that we can work through this. This doesn't have to define your life.
I do think they're getting better in the ER situation, not to speak on historical ER practices, but more and more I do hear that they sort of reassure clients that this is mental, meaning stress related. And I just want to make a plug for letting stress build up too much. Like, you just can't do that to your body, right? Your body will find a way to sort of turn on you. And here is one example, right? Like, a panic attack to me is the most humbling form of stress buildup, right? Like, your body is just saying to you, I've had enough. And here we go.
It's that breaking point. Yeah. So if we were to use the analogy of a bridge and the bridge breaking, let's try to catch it before the bridge breaks, before we're about to go through the toll booth. And let's really invest in ourselves in this diagnosis to make sure we know what our coping skills are, what our resources are, and who our resources are. What our body is telling us is that we are not safe. Yeah. So being able to reassure ourselves either through exposure therapy or through distress tolerance that we are actually safe. So if panic is usually from gardening and seeing that snake, we're safe right now. We are not going to get bit by a snake. It's a garden hose. And this comes with time and really good clinicians. Yeah. Maybe a little medicine.
Okay, let's review. So why does a panic attack feel like you're dying? It's kind of scary.
It is scary. We go into that fight or flight response and our body is telling us that we are in danger during a panic attack, and we are not in danger. So in that fight or flight response, we feel that we can't breathe. We feel like our body's on fire. We feel like someone is choking us. It feels like death. It is a real, true feeling, and the symptoms should not be ignored. So my suggestion is, if you believe it is a panic attack, still go to the hospital, because it could be that you're dying. They're so parallel and have so many similar symptoms that this should not
worth ruling out.
Absolutely.
Okay.
So do not feel any shame or guilt in taking yourself to the hospital, even if you feel this is most likely panic.
Okay. And I think a key takeaway treatment wise is medication is very in the moment, whereas therapy can help you long-term identify triggers, help you practice, kind of staving off those feelings of fight or flight, that adrenaline response, and then, just give you more confidence and like ownership again over your body and understanding why it happened, right? So you can prevent it from happening again in the future.
Yes. So let's get that medicine on board right away. And that usually would not be my approach to most mental health diagnoses. But this is a situation where if you have a panic attack, get yourself to a psychiatric provider. Okay. Be like Tony Soprano. Go see your Dr. Melfi and let's get ahead of this before it becomes detrimental to your life. Was she a
prescriber?
She was. Yes. She prescribed. Yeah, Tony Soprano took Prozac, which, fun fact, is really the gold standard for panic attacks. And I stick by that. So when I prescribe Prozac to my patients who are having panic attacks, I'm like, let's be like Tony Soprano. Take your Prozac.
Nice. Okay, I guess that wraps up panic. Our next episode is going to focus on ADHD.
Yes, so much to be said about ADHD as well. It's going to be a big episode. So please tune in, and thank you so much for listening today.
Thank you for listening. Make sure to subscribe to The Mental Edit and turn on notifications so you never miss an episode. Give this video a like if you found it helpful, and drop a comment with your thoughts or questions. We want to hear from you. You can also DM us on Instagram at The Mental Edit with topics you'd love for us to cover. And if this episode spoke to you, share it with someone who needs to hear it. No fluff, no BS, just real talk about what healing actually looks like.